This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask? We have the answers. This week, our episode is titled COVID and Men's Health. I'm Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. Justin, another chat between us, man.
Yeah. You know, we do these once in a while. I like these a lot. It's just you and me having a good conversation, talking about a topic that I think we know pretty well, and we both published on. And today's topic is going to be COVID and men's health. Obviously, at this point, we've talked on the podcast about COVID and how it affects men's health at different levels. But I think that we're at kind of a point where we started to gather data where we can have a more, robust picture of how COVID can affect overall different aspects of men's health. And I thought that, and you thought that too. We thought it was a good conversation to have because of obviously what's been going on in the last 2 years, in case we didn't notice.
I mean, yeah, it's like, it's pretty crazy to think that it's been 2 years. And, they've tried to, we've tried to do as much research as we can in a short amount of time to kind of get an idea of how COVID can affect, all different parts of the organs, right? People are doing research on the lungs. People are doing research on how it can maybe affect the brain. And we're still learning. I think the most important thing is that we're still learning. But, in this day and age where there can be a lot of misinformation, I think, if we can try to share or at least our interpretation of what's out there, for our listeners, just to kind of get a good foundation understanding where think things are and where things are headed.
I agree. And I think it's important also because I think a lot of people now, unfortunately, had COVID, and they do have questions about the effects of it on their men's health issues, their erections, their testosterone, their fertility, and we'll kind of get into it all. And there's other interesting questions that, I've come across that you've come across regarding having intercourse, engaging in sex. What kind of sex? Is there a different version of safe sex in terms of getting COVID from someone? And these are kind of conversations that sometimes aren't really being had, but, people think about. So that's what we're going to do today. Yeah.
So let's jump into it. So Justin, let's first talk what are your thoughts about COVID, and let's start with erections, erectile dysfunction. What are your thoughts on that?
Well, erections, how you have a good erection, the way we've described it in the past, I like to say you need 5 things. You need good blood flow to your penis, right? Blood fills your penis, you get a good erection, and
you don't have that, it's not going to happen, right?
Exactly. 2, you need good nerves, okay? You need a good nervous system. That's often compromised with things like diabetes and things like that.
Right.
3, you need good hormones. We've talked about this before. We've talked about testosterone levels are very important.
Right.
4, you need to be actually aroused by the situation, right? If you're aroused, you're in the moment that you're going to get erection. If you're not trying to be aroused, you're probably not going to get a good erection. And 5, you have to actually be in a good state of mind, like we like to say. Can't be stressed out. You can't be depressed. The brain is a very, very powerful thing. The mind is a powerful thing. And so you need all of these things to kind of come together to get a good erection. And
context needs to be right,
Correct. And, we do know that there is effects of COVID on, the vasculature, right? Kev, can you explain that a little bit to us here?
Yeah. So look, I think, when COVID first came out, the big things that it was affecting were the lungs. And so, scientists, doctors looked at it and they basically found some receptors and basically saw that it was causing damage to the vasculature. Right. And this all goes back to Justin's first point, if there is damage to the vasculature, you might want to start thinking, could there be damage to the penis? Because, vasculature is required for erections. And so, that's where, some of the receptors, I'm not going to get into the nitty scientific, aspects
we don't need
but
to
basically,
do that, right?
Yeah, but just, things that we find in the lungs, these receptors are also found in the, in the vasculature of the penis itself, And so, there's been studies that have been shown potentially that COVID's found in the penis, COVID's found even in the testicles. And so when we start thinking of the reproductive organs, we're thinking, this could have an effect in this area. And, with more studies that were shown, it basically showed that this is something that we should take a look at a little bit further, in our clinics, we've anecdotally heard about it here or there. And so I think there's definitely concern, and it definitely is an area that needs more research.
Yeah, for sure. And I think one of the, the big studies that everyone talks about, the one is the mask up to get it up in an Italian study where they showed that the prevalence of erectile dysfunction increased almost 6 times in men who had experienced COVID. Now, prevalence, is not causation. And it is important, but it is important to know that erectile dysfunction was seen in more people who had actually had COVID. Does that mean that you're going to get it 100%? No, that's not a fair thing. We can't predict that, but these things can potentially have an effect on you. So ideally, getting COVID is not the way to go, obviously, for more than one reason.
Yeah, I mean, in a group that we looked at a large database in the United States and over here at University of Miami, and we basically looked at patients that had a COVID diagnosis and any new onset erectile dysfunction diagnosis afterwards. Now, could there be data that was missed? Of course, there's still a lot of things that flaw the study, but we saw a 20% increased risk of developing ED after a COVID diagnosis. This is just an association, though. Again, no causative, mechanism is shown through these studies. We can only hypothesize how it is, but it's just something that to consider. And also, like, COVID's got a lot of variants now. The first variant was the one that was very, had a lot of the effects of like what we call long COVID. With the Omicron, it's a little bit more milder. So maybe, these findings won't really have that much of a, pronounced effect as we would expect with the earlier ones.
No, it's a good point. The thing about COVID is the studies are ongoing. It does seem to, as we know, have this vascular effect, and which is concerning for erections. And we have data that kind of supports this idea. The other thing, when we're talking about those 5 things that you need to get an erection is, we were talking about that great state of mind. And this pandemic for the last 2 years has really kind of changed, the mindset for a lot of people, for better or for worse. And a lot of times for worse, there's been a lot of data showing that there's been an overall increased burden of mental health disorders during the pandemic, which includes an increase in use of medications with these conditions. And that's usually something like an SSRI. And, these medications, as Kevin knows, as I know, can cause erectile dysfunction in itself sometimes in some patients. And obviously, being depressed, having anxiety, these things also can affect your erections. So even potentially not getting COVID, you can still, in the environment that we've been in, unfortunately, have issues with your erections. So, there's just so many factors involved. And there was another really cool paper that showed that phosphodiesterase inhibitors like Viagra, Cialis, the sales were on the rise during COVID, right?
Yeah.
Now that in my brain, it can be 2 things, right? One, people are having more sex because they've been locked up with each other, or 2, they actually need the medication. More people need the medication because of what's going on, whether it's they're getting COVID, whether they have anxiety, there's different ways to interpret this data. I don't know what the answer is, but, overall, a lot of things are pushing towards the fact that no matter what your experience has been in the last 2 years as a guy, somehow COVID may have potentially affected your erections.
Yeah, Justin, those are great points. I think there's like we're saying, there's still a lot we don't know, but, little hints here and there kind of give us an idea of where things might be headed. One of the interesting papers I read actually in the last week was a paper that came out of Singapore, and they basically were trying to take a look at, couples during the COVID times, what their sexual patterns were and whether it increased or decreased. And actually, what it showed was like, it didn't really decrease it, it actually increased it. And so maybe more guys were finding out that maybe they were having more issues with erections. I don't know. I think these are things we'll start seeing more and more of as we hopefully are exiting out of the pandemic and starting to see a little bit more of the longer effects on the other side. So,
yeah, that's a great point. All right, let's move on to the next question. I think that was a really great talk on erectile dysfunction.
Yeah.
I think we, really kind of brought it all together there. But so the next question we often talk about or get a lot about is infertility. Can getting COVID cause infertility in men? And I think that I think people are going to be kind of surprised by the answer because the answer is more complicated than I think most people would expect, right, Kev? I mean, I think there's a time span in which these things can be affected. Right. So
look, I mean, this is well. So this is it's a bit of a tricky question, right, Justin? Like,
very.
It's so look. Let's talk about the term. Like, let me just talk. I'm just going to get a little bit on a soapbox. Let's talk about infertility itself, right?
Right. Very important.
In research to really get what are the outcomes that we're looking for? It's birth, right? It's birth.
Absolutely.
Live births. And so if you're, it's very hard in the research world to really follow longitudinally all the way through that. So what we can do is see the small factors in between and kind of try to build and interpret and infer based on that. So look, Justin, if you get a fever, right, temperature, and COVID comes with the fever, right?
Yep.
Most of the time. You'll get. So let's not even talk about COVID. Let's say you just get a fever. What happens to your sperm usually during that time?
That's a great question. So I think the easiest way and how I talk about this with your patients and my patients is when you think about the balls, and trust me, we think about them a lot here, but when you think about it, they're outside of your body, right? And they're outside of your body for a reason. It's the one real organ that's outside of your body because it likes a cooler environment. In fact, your scrotum can adjust higher, lower through the cremasteric muscles to, adjust that temperature actually to an ideal setting. But it wants a colder environment is the important thing. A few degrees colder than the rest of your body.
A
little cooler.
Right, yeah.
So anything then that can compromise that temperature, can raise it, is going to potentially impact your fertility, right? Like the sperm is not going to want to go there. Potentially.
Keyword potentially, right?
Potentially. Correct. A lot of it's theoretical. Absolute. A lot of it, sometimes it's theoretical. Sometimes we see it in practice. I know I for 100% have seen it, and I'm sure you've seen it, but we can't predict who it happens to until we see a semen analysis, right? So
exactly.
These are the things, right? Like, we can give you advice to not do certain things, but I can't give you advice to not get an infection. I can't help you there. So take this back to an infection, Kevin. How does the infection affect that temperature?
So, any fevers that causes your body to basically cause a reaction and raise your body temperature, when that temperature increases in your balls area, right? That is going to possibly cause an impairment on your semen parameters. You could have a decreased sperm concentration, right? Now, let's think about it in a temporal or time kind of frame, right?
Right.
So let's say you have a fever, and then in those first couple months, there is a chance that maybe you have a decreased sperm count, all right? But I think anecdotally, and I'm pretty sure in the research it's been shown with other infections that cause fevers, not just particularly COVID, but you start to see what's called kind of like a recovery period afterwards, and usually around the 3 to 6 month mark, typically around 6 month mark, it's as if nothing kind of happened. Now, again, this is not absolute. I think there are some cases out there that have been presented where it's a little bit more permanent, but I think in the overall scheme of things, I think most people recover, right, Justin?
Yeah, I mean, it takes about 3 months for your sperm to regenerate in your testicles. So what you're talking about here is a short period of time where, whatever sperm was being made is kind of killed off, and maybe not all of it though. So, it may compromise your semen parameters. It may not make you have no sperm. Once again, we don't know until you are in front of us. But the thought process is, any infection raises your temperature, just like, a hot tub. We tell patients not to use a hot tub if they're interested in fertility, because you're literally boiling your sperm away. And if you can think about it that way, right?
Right.
You're increasing the temperature of your balls to a level that is higher than your body temperature normally. Now, does a hot tub, cause infertility in every single patient every time? Absolutely not. That's not the case. But have I seen guys who've come into my clinic and have said, hey, I go into the sauna every day and I do a hot tub every day after the gym. And then they come in and they have very low sperm count. I say, hold off, come back in 3 months and don't do anything. And they have a normal sperm count. Have I seen that? 100%. I have seen that. So, these things can happen. And in a similar way of any infection, COVID is like that any infection. Your temperature increases in your body.
Yeah.
Your testicles also increase temperature because of the infection, and it could potentially kill off temporarily your fertility, right? It can compromise your sperm. It can lower your sperm. It may not necessarily completely make you infertile temporarily, but once again, we can't predict that. We can only go off the data that we have. Now, the data though, Kevin, I think long-term, like any other infection, has shown that semen parameters should recover after COVID. Is that correct?
Yeah, I mean, I think it's still an area that we need to do a lot of work.
Absolutely. Sorry. Right? There's no absolutes here. Sorry.
So I don't, there's some papers that are suggestive, and a lot of these papers still are flawed, right? It's good to get the information out there because it helps us think and helps us try to put things together. I think the important thing is that, in the time period that you have COVID, if you have it, if you've been trying to conceive, there could be a chance that you're not able to conceive during that time period just because your semen parameters are just a little hit on. But there's probably just as many guys who, in that time period, were able to conceive. So it's not, it's not so black and white, like I have COVID, all this stuff. So it's a little bit more of a tricky question, a lot more layers to it, a little more nuanced. But I think the important thing is that, I think, as you touched upon, there's a recovery period for any sort of febrile illness that you get.
Exactly. Temporarily, there is probably, if you had fevers during COVID, when you had COVID, temporarily, there's a good chance you probably had a hit to your semen parameters. Can we tell you to what degree? No, I can't. And the other thing is, a lot of guys, we don't know what their baseline semen parameters are anyway. So it's very hard to say, what did you decline because of COVID when we never had a semen analysis prior, right? So it's kind of, sometimes it's oftentimes with other things, there's other health things that you can do to compromise your fertility, where it's chicken or the egg. I don't know what happened, right? Testosterone can cause infertility. We've never had a semen analysis on you, and maybe you had a low sperm count, and then your testosterone killed whatever was left, and now we just have a low sperm count when you're off of it. So, overall, though, I think that short-term fevers can compromise your fertility, and that includes COVID. Long-term, we need to do more data on how it impacts fertility, but it does seem that it can, your semen parameters should, in theory, recover, but there's no guarantees.
I completely agree, man. I'll go personal on this. I had COVID, and I got a kid afterwards. So look, for the most part, I think it should be fine, but in that time period, there could be a transient, decrease. But all right, man, look, I mean, what do you think, Justin? Should we touch a little bit on the vaccine now, or do you think we should move on, or is this the time to kind of talk about it?
Well, I actually really wanted to talk. I felt like the infertility thing kind of was perfect transition to just talking about sex, because I think that that's something that a lot of people ask about, we're talking about sperm, we're talking about the compromise of sperm, but people have asked, can COVID be found in semen? Can it be found in semen, and can it be transferred, during sex? Is COVID the next STD out there?
Right.
Right. And it's pretty interesting, the results that are out there. You want to just enlighten us a little bit, Kev?
Well, okay, let's just go to the. Let, I'll start off on the finding of COVID in semen. All right. First
Okay.
off, let me say the research is kind of everywhere. Right.
Absolutely.
You got studies that show that it's not in semen. Then you got other studies that show it's in semen. Right. I'll tell you, I don't really know. Right. It's not consistent stuff. Right. It's not very consistent. All that, and that's with a lot of this COVID stuff. And but there are studies that show that it's been in there. So look, that's what we can say. It's been in there, but actually transmitting and all that stuff, I don't know. I mean, what do you think?
So I think it is complicated. I think that there, like you said, 100% there are studies either way. The majority, there's been a very small study, I think, that showed that they did find it in the semen. The majority of the studies have not been able to find it in the semen. So does that mean it's a 0% chance? No. I would say that getting COVID through sexually transmission and sexual activity is probably low. We really do need to do more research on this.
Well, let me stop you there, Justin. So let's digress just a little bit. So how does COVID mainly get transmitted?
Through droplets,
breathing,
droplets,
yeah.
Kissing.
There you go, man. Like when I read some of these studies, like, kind of think to myself, like, you're doing a lot of breathing during sex. I hope you are, right? I don't know.
People are just passing out during sex because they're holding the
So, look, I think when it comes to transmission, probably breathing is the
No, I think it's important to know. But I think also, people have asked about vaginal secretions. And,
there you go.
It's been kind of similar results. The majority of the studies that I've looked at really did not detect any. There was, I think, one study that found it in vaginal secretions that I could find. So once again, it's one of these things it's not a 0%. I still would say overwhelmingly it's very less likely in vaginal secretions. But I can't say with 100% certainty you couldn't get it with couldn't find it in there. But I think you kind of really hit the nail on the head, though. The best thing you can really do is to really just follow CDC guidelines. We know that Omicron clearly spreads more easily, and I think if you're going to get infected and you're having sex with someone, it's going to be because you're kissing them. It's going to be because, you're breathing the same air as them. So I think the best thing to really do is, before meeting up with someone, engaging in sex, be aware of your own symptoms. Be aware if they're having symptoms.
Right.
Consider taking a rapid COVID test. I think these measures, and making sure you're vaccinated, making sure your partner's vaccinated, these things, and wearing a mask. These are all the things that really are going to go a lot further in protecting you from getting COVID than, worrying about whether having sex, the sperm itself. It's really the act of everything else that leads up to the sex. And then what do you think? Yeah, go ahead.
I think that was such a great, just explanation and just kind of guidance on this whole thing. Like, look, man, I really do hope we're getting close to the end of this, And the COVID is so different from when we first started, right? And I think a lot of these questions when we first started, and it was just like, oh man, like you have sex and then you have this and you're going to have like long COVID, all that stuff. Those were like, pretty significant concerns. And who knows, maybe we're going to find something else out in the next couple of years. But I think everything you said, though, is like these are the things that doctors, researchers, scientists have all kind of learned and tried to ascertain as the best way to protect yourself during this. And I think you put it really nicely and clearly. So
thank you. I appreciate that. So I think we should just quickly wrap up with the vaccine. What do you think, Kev? So tell us a little bit about the COVID vaccine and men's health here.
Yeah. So look, it's, we did an episode with Dr. Ranjit Ramasamy. I think it was like the third or fourth episode. If you guys want to go back and take a listen to that. But, look, it still has a lot of misinformation out there. And, look, with any research study, you can always point out, potential flaws. Like that's a limitation. That's a limitation. But the study that Dr. Ramaswamy put out in JAMA, one of the biggest journals out there, showed that there was no effect in terms of, receiving the vaccine and your, parameters, your semen parameters before and after, and that was his finding. And it was important to try to take away all the misinformation that the vaccine causes infertility and such like that. I don't know how much we can keep beating this horse, to say, just get
you're right. Yeah. I mean, listen, get vaccinated. It doesn't cause infertility. I was in the study, full disclosure. My semen parameters stayed exactly the same. Actually, they got better. But I'm just saying.
Yeah. So, look, man, I think we're coming out of this pandemic. Again, I hope so. And we'll start to see some more and learn some more about it as research goes on. But it's important that, look, all us doctors, researchers are actively trying to find and disseminate the information that can best help our patients. Right, Justin?
I think that's the key. And I think that the key really here is that, and we've kind of pounded this over and over as we've been talking here, is that this data, the literature, the research is ongoing, right? Like this is something we're still learning about. We will probably be still learning about for a really long time. And, the data, just like anything, we learn as we go, we learn as time goes on. And our goal as doctors is to provide you with the most updated information that we have, so that we can help guide your care. And I think today, like what we did is we kind of brought you the data that we know, and how COVID can affect men's health, how the vaccine will not affect men's health. Right. They will keep you going and probably, hopefully prevent a lot of these things. I mean, there's a lot of ways, if you think about the vaccine, how it can, and when we talk about those 5 things, right, you don't get the infection, potentially your vessels don't get compromised, right? You don't get the infection. Maybe maybe other stuff is better. Your mental health, you feel a little better, right? Maybe you're a little less stressed out. So maybe your mental health gets better. Maybe your relationships with the people, you're less isolated. So, there's a lot of ways potentially that these things, it can help. So, it helps it prevents you from having fertility issues. Potentially you're not going to get those fevers, even if you do get COVID, so I think that there's a lot to be learned, but we have learned a lot still.
Right. At this point. We've come so far, man. Like, dude, to be able to at least say some things with a little bit more confidence now 2 years later, I think it shows, what research and all that stuff can do.
It's crazy. I mean, you and I, we were in the hospital. We were in Miami, which was like, it was pretty crazy at one point. Yeah. And, I just remember literally not touching or looking at anyone. Yeah. I would go, remember we would talk, we would go into work. I would change all of my clothing in my car and throw all the clothing in the trunk because I had no idea what was, we didn't know. So at least we know, like I would just wash all my stuff. I wouldn't even bring my phone into the hospital because I was worried about.
We had plastic bags.
We had Ziploc bags. We had Ziploc bags for everything. Yeah. I would throw away any pens, like socks, everything. I would just throw it away. And we've come a long way from that. I mean, it's kind of crazy when you think about that.
Now
time.
I'm back to licking the tables again.
Exactly. It's got to keep it clean. Got to keep it clean.
Well, hey, Justin, I think this was a great conversation, man.
I thought this was great. I really enjoyed this. So let me wrap it up here. So thanks again for everyone for listening to Man Up Pod. So any questions, comments, concerns, please feel free to message Kevin or I on our social media platforms. It's our names. Or you can also message us on Man Up Pod. Our accounts there are on Instagram, TikTok, Twitter. So feel free to message us there. We do have our website. Our website is up. Kevin, what's our website? Where can they find us?
www.themanuppod.com.
That's new. So we're really excited about that. We're going to really be working up. We're going to try and make it a good resource for all things, guys, just being dudes doing medicine stuff together. Always download, subscribe, give us a review on Spotify, on iTunes, 5 stars, and a comment is always appreciated. For Kevin and Justin, thanks for listening. Until next time, everyone, be safe.